Hey everybody. Hey everybody, we're here with Dr. Mike LoSasso. He is the medical director for the Frisco Emergency Pet Care. That's in Frisco, Texas. Question for you. You're on our advisory panel. We really appreciate it. You're a veteran in emergency medicine. Hydrogen peroxide. We hear the good and the bad. Give us, for our students' sake, what are some of the cautions and when would somebody use hydrogen peroxide?
Well, hydrogen peroxide has been used for a long time to induce vomiting in dogs, but it's got some drawbacks. So, because it produces a large amount of foam, there is an increased possibility for aspiration for those dogs and breathing that foam in. It's especially important in the brachycephalic or the short-faced dog breeds, your Boston Terriers and Shih Tzus, even the Boxers and the Shar-Peis. The big guys still have a shortened airway up there in their heads. So for them, most of the time we're going to recommend doing that under veterinary supervision, either with a drug called apomorphine, which we use in emergency practice, or some veterinarians will use hydrogen peroxide in those cases, even in their own hospitals. But those are being supervised if they have an airway difficulty, we're there. If you are 30 or 60 minutes away from your veterinarian and your dog eats something that's going to be rapidly absorbed and is really toxic, whether that's something like ibuprofen, for example, which is very quickly absorbed and is very, very dangerous to dogs, then we don't care quite so much about what the possibilities are. We know what's going to happen with that toxin. So you may even get advice from an emergency hospital to induce vomiting at home with hydrogen peroxide.
So the key here is make sure you talk to a veterinarian before you do something like this.
I definitely would, yes. Because hydrogen peroxide has been used a long time. Not a lot of dogs have complications, but if your dog has a complication, your percentage rate just went to 100%. And we would rather avoid that, especially if it was something that could wait a little while and could benefit from proper veterinary care.
What about with cats, if the cat got into something toxic?
Cats are a lot more difficult. Peroxide generally does not make them vomit, and it's really difficult to give hydrogen peroxide to cats, in case you've never tried. The real downside, even in a veterinary hospital, is that apomorphine doesn't make cats vomit either. So we end up using other drugs. There are a couple of different sedatives that we use that have a side effect of causing vomiting in cats if it's given a certain way. So that's our go-to, even though the success rate there is probably less than, or right at 50%.
Okay, thank you very much.